Welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. We are located in Dinsdale, Hamilton. Our phone number is 078467956. What's our topic today? Acupressure point for hip injury recovery. We're talking about injury is about acute pain in the hip. Way back the hip. Hips over here. The hip area. So that including your groin. If any pain in the groin or hips, all this area, we're going to talk about this today. Well, if you have a new injury on that, normally you go to the doctor or you go NE, emergency, right? You may get X-ray done or MRI, whatever. If there is no fracture, or even there is fracture, you're in a lot of pain, then I'm going to show you some acupressure point today to relieve the pain. It depends on how serious is the problem. Once you relieve the pain, we expect it to come back. Well, it can come back in 1 hour, 15 minutes, or the next day, depending on how serious the problem. But this is going to help a lot. All right, let's start. And again, this is not just for acute pain. Any pain in your hip, in your groin, that's going to help. Right? That's going to help. Now we talk about ankle pain, knee pain. Today we talk about hip pain. We talk about, I'm going to show you acupressure point. But if you're an acupuncturist, can you use the point instead of using your hand, your fingers to press the point, you use a needle? Yes, you can, absolutely. It will work even better. Guaranteed. All right. So it's in here. So normally we talk about the last two videos. This is a distal acupuncture. This is not a local acupuncture point, right? The acupuncture point in here, a pin in here, you put needle in here or you rub it in here, you are using local acupuncture point strategy, right? Or if the pain is in here, you rub it in here, again, you're using a local acupuncture strategy. What we talk about today is distal acupuncture strategy. So with distal, you need to know the image, how the distal area link to here. As an example, I keep explaining to you in this so you know in every video, so you get it very understand it very well on this image. Right? If you don't have hands, what are you going to use? Instead of hand, you're going to use your leg. This is your hand. Right? You're going to use that to carry bags, get yourself on. Use this to dress yourself. You're going to use your leg your toes as a fingers to grab spoon and eat. You use it to grab pens and write. And this is your hand. Let's have a look how they're connected. Foot, toes, hand, fingers, same structure, similar, not same, similar. Ankle, wrist, lower leg, forearm. What is the joint? Knee, elbow, shoulder, hips. So that means you can use, when pain in here, you can use shoulder to treat hip. It's one area. Now, in our technique, we call reverse, which means in here, you can do that. To massage here, you put needle here, it's okay. You put it back, it's fine. You when we do massage, it's harder because the muscle in here is bigger, stronger. So your pressure is quite difficult. You have to use a lot of effort to push it. And especially in an armpit, it's not as convenient to do that, right? You have to dig it very in and you probably can't find a point. It's not as convenient. So I'm going to show you to use your wrist. Right. This is a reverse. Use your wrist to treat your hip. Yes, it can treat your hip. Now the technique is in here. You use your knuckle over here, from here to here on the wrist, and 3 fingers below your wrist. Any point over here. If you can hit any point in here, a tenderness, we call RC point. They're quite sensitive. Put a needle in there, or just rub it. How long do you rub it? 30 seconds. And keep going, keep going, keep going. And here, 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 to detect the sensitive point. Right? Where can you do it? Apart from here, back here, all this here. You can find the point and give it a rub. Hit it hard, rub it 30 seconds. Then you'll find that your hip pain or your groin pain will feel better. So when you find those points, if you have 10 points along here, you can give every point 9 seconds instead of 30 seconds. And when you try all out 9 seconds each point, then you move your hips to see whether it's painful or not. If the pain reduces, keep going, give it another turn, and then try it again. Right? Or you can try on the opposite side, or you can try after this, you can try on here, and it'll give you even further relief. Right? This is very simple technique, and a lot of countries still locked down, like Malaysia. And we're so lucky in New Zealand, we're not locked down at all. Now, I still want to show you this, share with you, encourage you that by taking painkiller, there's a lot of side effects, and you can do something without harming your body. Just get this point, and you can get instant relief. When you get instant relief from the pain, that actually you test it out that it works for you. And what is the next strategy for you to get better? Do it every day. Do it every day, at least once a day. And whenever the pain appears, give it another one. Give it another session of self-treatment by using acupressure over here. If you're an acupuncturist, this is one of our strategies. It's very useful. I use it all the time for a patient. It works fantastic. Now, apart from that, your patient is not coming to you every day. Then show your patient how to do this. If you're an acupuncturist, you can put needle in here, and here, and here, even opposite side over here. Now, I have my live webinar coming up in March. If you're an acupuncturist, you watch this video, you want more information, please leave your message down there. If you're a patient, no matter where you are, if you're not in New Zealand, hey, go and get an acupuncturist to fix your hip pain. Now, if you live in New Zealand, in Waikato area, Tauranga, Auckland, Cambridge, Raglan, we have clinic in Hamilton, Dunsdale, Raglan, and Cambridge. Now, welcome to call us. Our phone number is 078467956. 078467956. Now, that may give you relief, but if the problem is more serious, you want to get it recovery faster, call us. I'll see you tomorrow. Thank you for being here and supporting. Please like this video and share this video to your family or friends if they have a hip pain. Hip pain may be caused by arthritis, and we can help that as well. Stay awesome. See you tomorrow. All right.